We now move from environment to health. The Lagos State government is investing so much into the health sector in order to provide quality and affordable health services for all those who reside in the nation's commercial nerve center. At this time, the state government has set aside a health insurance equity fund that will cater for vulnerable residents in the state.
The Lagos State government is not resting on its hands with regards to the enrollment of residents into the health insurance scheme as it pushes to get more people on board. The State Health Management Agency is seeking to improve its services with the launch of a new funding arrangement announced to beneficiaries at a town hall meeting in GRA Ikeja.
Governor Babajide Sanwo-Olu has deployed over 700 million naira as equity fund to pay for health insurance for the vulnerable and indigent residents of the state. Individuals who fall under the vulnerable group were identified using a multi-dimensional poverty index tool to ensure the accuracy, reliability, and validity of the data generated. To ensure that all deserving of quality healthcare service and cannot afford it are adequately catered for, the Lagos State Management Agency will continue to grow the vulnerable register and develop innovative ways to provide access to quality healthcare services for all. Over 100,000 beneficiaries of the Equity Fund are currently enjoying free quality healthcare under the Ilera-Eko social health insurance scheme. To complement the state government's effort, the Lagos State Health Management Agency is also at the verge of rolling out an innovative health financing initiative called EcoSha. EcoSha is an innovative way to raise funds from philanthropists, organizations, donors, and alike to crowdfund health insurance premiums and adoption of indigent and the vulnerable on the scheme in partnership with government. It is our aspiration that all these resources pulled together will further improve the health indices of Lagos State, which ranks far above national average, and further the dream of attaining universal health coverage in Lagos State.
1% of the Lagos Consolidated Revenue Fund has been set aside by the government to cater for the vulnerable population. Some of those enjoying the scheme applaud the state health authorities.
I want to say a very big thank you to the governor of Lagos State and the organizers of this great initiative. Some weeks back, I was so sick, typhoid malaria, and they tried everything, but on getting to the hospital, because I was under the scheme, I was attended to immediately without paying a dime. I just want to plead with the organizers and the governor most especially to make sure that this continues and ensure that it gets to the rural areas, especially those living with visual impairments, blindness, and other disabilities.
I came to know about this Ilera-Eko through Bethesda Home for the Blind, where I'm in currently. So they are the people. There was a time I was seriously down, malaria. So there was no money anywhere. So through the help of this home, I was able to be admitted into one of their the healthcare center. So that is how I got to know about it, and they treated me free of charge without collecting any dime. So I really want to thank God for them, for this kind of initiative. It's a welcome development. This is what we have been craving for. This is what we have been preaching about. For especially people like us living with visual impairment, we really need a lot of this kind of support. So we are like Oliver Twist, we are still asking for more. Please let them extend this thing a little bit.
Here is more on what's being done to expand the scheme.
Currently, we have about 58 of our primary healthcare centers under Ilera-Eko providing care. And we are working with the Primary Healthcare Board to increase that number gradually. What is important is that if you go into an Ilera-Eko care center, an Ilera-Eko center, you should be assured of the quality of care that you will get there, right? So it is not just every facility, whether public or private, that automatically qualifies. We want to be sure that when you get in there, you will be well taken care of. So we are working with the Primary Healthcare Board to continuously increase that number as we go along. We have other initiatives that are coming. My Honorable Commissioner is seated there. It is a great priority, actually, for health sector to ensure that all PHCs are fully and totally functional and are able to meet people. As you said, they are next door to everybody in the grassroots. So it's something that we are working on very actively. There are no exceptions. We don't look at your age. We don't look at any pre-existing conditions. There's nothing like that. Once you live in Lagos, you have access to this plan, and whatever is covered under that plan, you benefit from it. So we actually, during engagement with 60 plus, we came up with this seniors plan, which allows our elderly to not just have benefits from the normal plan, but they have the facility to go once a year to have a massive screening done. So we'll check them for cancer of prostate, etc., to be sure that they are healthy into the next year. The benefit package is very specific in terms of what it would cover. We can't cover everything. Now, as we increase the number of people that come under this scheme, we are able to drop the cost and expand the services. That's why it is of advantage that people buy into this scheme. Because when you have a huge pool of funds, you actually have sufficient latitude to now start adding things into that scheme that you find that is a need, and while also dropping the amount. So we have 8,500 for an individual. Now, if we were to increase the number of people under that scheme, it's very possible that we drop that amount to 6,000 using actuals. I'm giving an example. And we can add more benefits. The last actuarial analysis that we did allowed us to add things like glasses, which were not there before, dental care, which was not there before. We even have cover for cancer up to a certain amount.
A referral reward plan has also been introduced by Lashma to attract more Lagosians to the scheme.
Ilera-Eko referral reward program. It's a program that is designed for all residents of Lagos State that are coming on the Ilera-Eko health insurance plan to have the opportunity to make some form of enterprise on it. That means that they can go home making money for every enrollee that they share the gospel of Ilera-Eko with. It means that for every family plan, they can access 5,000 naira into their account. For every individual plan, they can access 2,000 naira into their account. And you can imagine if, for instance, you have like 100 family, that's 500,000 every year, which is guaranteed for every resident as long as they continue to bring people on Ilera-Eko health insurance plan. It has come to stay. It's an integral part of what we do. It's part of our initiative, and indeed it's an innovation, and we've added this to the sales of our plans across the state. So once you are able to refer people, we onboard you, we register you, we train you. In fact, we organize a regiment of lifelong training for you to be able to do very well on the referral program.
And the wife of the State Commissioner for Information represents the wife of the Lagos State Governor, Dr. Ibijoke Sanwo-Olu.
The plan to promote the health of Lagosians has been anchored on health insurance. Therefore, huge investment has been expended in health insurance since the inception of this administration. As we speak, it is gratifying that the government has successfully onboarded all public servants in Lagos State on Ilera-Eko. Wow. While Lagos also became the first in the country to commence health insurance regulations, based on evidence that a sizable number of residents of the state cannot afford to pay their health insurance premiums. Mr. Governor approved the Ilera-Eko Equity Fund, which is 1% of the state's consolidated revenue fund, as part of the government's social protection plan. Through this effort, The government provides financial protection to the poor when they seek health care services to boost their purchasing capacities and stimulate economic growth. As a government, the commitment of the present administration of Mr. Governor is to continue to support the quest for universal health coverage in Lagos State through continuous support for the Ilera-Eko Equity Fund and other health initiatives of the state government. No stone will be left unturned towards ensuring that all residents of the state can have access to quality and affordable health care.
Over 600,000 residents are currently registered under Ilera-Eko Health Scheme. The state government is calling on other individuals to take advantage of the initiative and enjoy affordable and quality healthcare services in Lagos.